Good afternoon, everyone, and thank you for joining us for the August OSEP Monthly Technical Assistance Call. It was wonderful to see many of you in person a few weeks ago at the 2023 Combined Leadership and Project Directors Conference. Thank you for making time to travel to DC and engage in thoughtful communications about how to improve outcomes for infants, toddlers, children, and youth with disabilities and their families. There was a lot of great energy generated from the conference, and we look forward to continuing to partner with you in our shared work. Hopefully, by now, you have seen our new guidance regarding general supervision. While we held repeated sessions during the conference, we know there were several important competing sessions. So we will cover the guidance on future OSEP monthly TA calls in the coming months. In the interim, if you have questions, please reach out to your OSEP state lead. Note that we will also be conducting several DMS engagement activities throughout the coming months. And we will resume universal TA throughout our monthly calls on DMS in the coming months. However, we will not be holding one this month. So today's call will be the only OSEP monthly TA call in August. I know we also held a solo session on today's presentation during the conference, but since you may not have been able to attend it, we have invited our colleague from the U.S. Department of Health and Human Services Center for Medicare and Medicaid Services, Center for Medicaid and CHIP Services to present on the new flexibilities for implementing Medicaid in schools. I'll now turn it over to Richard Kimball, who's Technical Director.
Thank you, Al. Yes, my name is Richard Kimball. I'm by training a public health nurse. I landed in health policy after I finished my PhD in 2010, did some academia for a while, and then made it back into the world of government. And we've been tasked to, work with the Department of Education on a variety of different topics, including with Medicaid, the care of, those infants, toddlers, and school-age children in particular. So I'll be kind of going over that and what we mainly said at the OSEP. I've added a couple slides on the Technical Assistance Center that we've since started, and I'll talk a little bit more about that. So next slide, please. Actually, 2 slides forward because I think there's an OSEP slide. Yeah, we can get rid of the disclaimer. Thank you. So again, I'll just be talking about the school-based services, kind of understanding the current policies in Medicaid. And then I'll be going over the comprehensive guide that came out in May and our informational bulletin along with that. Talk about some new flexibilities, the compliance timeframe, and then also talking about the BSCA, the legislative work, the timeline and future work for us with ED and CMS or Medicaid program. Next slide, please. You probably know this already, but the Biden-Harris administration has made a top priority to strengthen and expand access to Medicaid and CHIP services, a priority. Obviously, schools are really important providers of Medicaid, some of those direct medical services, particularly with the kids that are IDEA eligible and enrolled in Medicaid. Medicaid and CHIP together cover more than half of all children in the United States. And school-based services, can include any service under EPSDT, and that's just a fancy way of saying a guarantee of any service, basically, for a child that's 0 to 21. And then that can include anything, like I said, any physical or mental health care. We know and recognize that, and heard from a lot of stakeholders, that schools are not the usual place for providing medical services, and they feel that there's a high administrative burden. So one of the things we try to do in the guide is to decrease that as much as possible and give them some flexibilities. And that's why we're here, and we're also continuing to work technical assistance with states and LEAs to decrease administrative burden for schools. Next slide, please. So just a general overview of kind of what Medicaid is and what Medicaid isn't. We recognize that, again, schools are primarily education, right? They're not providers of healthcare services generally, but there is a mandate for providing at least those IDEA services. Most third-party healthcare providers we recognize do not reimburse for Medicaid services inside of schools. A lot of states in the past have used fee-for-service rates. Generally, we've said that those had to be the same as the community rates, but now we're allowing the flexibility for those rates to be higher as long as there's some justification of that. Medicaid covered services provided in schools, they always have to meet, the statutory and regulatory requirements. That's something we can't get around. We can provide flexibilities as much as we can, and that's what we've done in the guide, but we still had to stick to this, the statutes and the regs. Next slide, please. So there is a benefit category called, EPSDT. That's just the general kind of catch-all for everything. But there is not really a Medicaid benefit category called school-based services. Those are just kind of loosely defined as any service that's provided in schools by qualified Medicaid providers. And that can, vary state to state, right? Just as licensure is generally done, state to state, so can those qualified Medicaid providers. So what's available in one state is available in one state. We always say in Medicaid, if you've seen one Medicaid program, you've seen one Medicaid program. We have 56 different Medicaid programs, including the 50 states, DC, and the 5 territories. So everything's a little bit different in what they cover. To be eligible, the services have to be included as those in the Act, the Social Security Act of, Title 19. It describes, in 1905A, describes the different services that are coverable under Medicaid. And we have something called a state plan amendment, and that's what really kind of guides us in Medicaid and states, for the state Medicaid agencies. They have to submit to us a plan called a state plan amendment. We approve it, and then that is what guides reimbursement for these services in schools. Next slide, please. So Medicaid services in schools are not limited to IEP or IFSP under IDEA. They can include 504 plans. They can include any other Medicaid enrolled child, and any Medicaid service can potentially be done in schools. We recognize, obviously, not all schools are going to provide all services all the time, but they are certainly open to doing that. And certain, states have gotten very creative with school-based health centers and other ways of providing those services. CHIP services are slightly different. That's the Children's Health Insurance Program, falling under a different category and a different, funding source, but still out there and available. And any medically necessary service really can be, that's covered under EPSDT, can be given to children in schools. So again, any Medicaid enrolled child can receive services, not just IEP, IFSP, or Section 504. Next slide, please. So that state plan amendment that I mentioned, really kind of guides us and allows states, since way back in 2014, we kind of changed some policies, and we used to only allow IDEA services to be covered, and the kids with disabilities to be covered under Medicaid, those enrolled. Now, since 2014, we've allowed what we call, free care. Maybe not a great, fantastic name for it, because it really has nothing to do with care that is free, but any care that's provided in schools, that's provided to everybody, can now be charged to Medicaid if that child is enrolled in Medicaid. Some states that have taken advantage of that are listed here. There's 13 states. Virginia's on the way very soon. They have a state plan amendment in with us right now, and they are expanding services. And in some cases, like I'll take Arizona, California, and Colorado, our first 3, they've expanded to the entire range of, Medicaid enrolled children in schools. Georgia, for instance, has only expanded into nursing services provided in schools. So even though these are all free care states, we consider them, there could be a variety of different services they cover or don't cover. We encourage, and we have been encouraging all states to adopt, this Medicaid increase of, expansion of access really to services. There are already services that are going to be done in the state. We just think that providing them in schools would be a really great idea, right? There's a captive audience in schools, and we have a great opportunity to provide some of these services. Next slide, please. So I'd like to talk a little bit about the Bipartisan Safety Communities Act that was passed in 2022 now, just over a year ago. And it required CMS, Medicaid, to update our claiming guide. That was what we kind of, did with our guide that came out in May. We're calling it the guide. And it went kind of beyond just claiming, but into direct services and administrative claiming, to launch a technical assistance center, which we did in June, and to start working on the release of $50 million in grants, which we are doing, currently, and those grants will start to be announced probably second quarter of next year, and we'll get those underway summer, second or third quarter of 2024. So August 2022, we released, after the Bipartisan Safety Communities Act was passed, an informational bulletin kind of describing what we were going to do. Finally, in May of 2023, we came out with that big guide, officially called the Delivering Services in School-Based Settings, a Comprehensive Guide to Medicaid Services and Administrative Claiming. So that was the kind of the whole thing. And we provide a series of new flexibilities in that after much work. It's about 180, 190 pages long. And we updated our Medicaid school-based administrative claiming guides from 2003 and then also one back in 1997. So we've been busy. Next slide, please. So finally, the Technical Assistance Center began in 2023 in June, just a couple months ago. We have been working with a contractor, and these are the goals. I won't read them all to you here, but we're trying to support the Medicaid agencies and the LEAs and the school-based entities to expand the capacity for providing these Medicaid services and reduce that administrative burden. Finally, we're going to do in 2024 that $50 million in discretionary spending for grants, and we'll probably again be announcing that about second quarter of 2024. Next slide, please. So this was kind of the big introduction to the claiming guide of 2023. We released it May 18th. Again, we collaborated with the Department of Education. We issued a lot of guidance, nuts and bolts of direct services and how to claim them and different methodologies to use. And one of the important things for us always in Medicaid, and I'm under financial management, is the source of the federal funding. One of the more popular ones is something called certified public expenditures, where you certify the costs that you're going to expend anyway on caring for those IDEA kids and the free care kids. Okay, so we're going to go through that a little bit. Next slide, please. So what does it include? It includes a variety of new flexibilities, including billing, a random moment time study or just time studies, and how to bill with those, provider or third-party liability, provider qualifications, and how states can adopt and make it easier for schools to get reimbursed for Medicaid and those CHIP services that I mentioned before. And also we do some recommendations on how states can work with managed care plans, and we're continuing to come up with policies and best practices with the Technical Assistance Center as well, which I'll just call the TAC going forward. And we also talked about ways to simplify interim billing. One of the things you have to do with the cost methodology and those certified public expenditures I was mentioning is have an interim billing process. So we'll go through a little bit of that. Let's go to the next slide, please. So just as a reminder, how Medicaid can support school-based services. Again, we want, part of it is admin claiming. Under admin claiming, you can use Child Find to look at eligible students who might be, eligible for the Medicaid program along with their family members. You can get those enrolled. So that is part of, eligible reimbursement under Medicaid administrative claiming that can be done in schools. Again, going through that Child Find program and providing, Medicaid covered healthcare services in schools and seeking payment for those services. Can be a variety of services. Again, anything covered under that EPSDT, physical or behavioral health. And then offering, Medicaid services and expanding those services that support, at-risk Medicaid eligible students. We often hear about the lack of behavioral health and mental health services in schools, and trauma, related to gun violence and other things in schools can certainly be supported through the Medicaid program. Administrative program activities like enrolling and re-enrollment of beneficiaries can occur as well, and that can be covered under Medicaid. And hopefully, providing some of these primary care services can help reduce emergency room visits and tertiary care visits, right, as opposed to the primary and preventive care services that can be provided in schools when children, are captive audiences. And promoting, any kind of healthy learning environments and preventing, disease and things from happening, and those, again, those expensive tertiary care visits. Let's go to the next slide, please. This is not that interesting always, but some of the new flexibilities that are out there are billing. I talked about those interim payments, and that's mostly what these really revolve around. Instead of submitting a claim for each and every service that's done by a speech therapist, occupational therapist, and physical therapist, schools can create a roster of different students who would be involved in school-based services, and they could tick off that they've received at least one of those services during the month and receive, X number of dollars, whatever that dollar amount would be. Again, come to us with proposals, and we'll look at them. There can be a per child per month rate, interim rate. Again, these rates are why they're so loose is because ultimately in a cost methodology, you have to reconcile at the very end to what the actual costs were. So we're allowing a lot of flexibility up front, knowing that in the back end, there will be a reconciliation. Again, there's that option not to submit a bill to like the state Medicaid information systems for each and every service. And that's another flexibility. We're not going to force states not to. If they want to keep that, mechanism going, they certainly can, but it's a flexibility to allow less, again, administrative burden on schools that are not usual places for Medicaid services. Next slide, please. I talked about fee schedule rates and community rates before. I'll just mention it again here. Again, allowing states to pay higher fee schedule rates for services offered in schools, and that just has to be demonstrated and continue to be economic and efficient. That's part of the Social Security Act that says that all Medicaid services must be economic and efficient, and that's of course open to interpretation. But again, with justification, we would entertain that thought of higher rates in schools. Bundle payments, generally speaking, we had a policy back in 1999 that stated that there was a prohibition of using bundled rates in schools. We had some malfeasance going on, so we issued that state Medicaid director's letter. But we've just clarified that in our guidance to say that, again, in a cost methodology where there's some kind of interim payment, it has to be reconciled. Sure, you can do a bundled payment because that is eventually reconciled to actual cost at the end of the day. Next slide, please. One of the big things that will allow a lot of decreased burden is allowing states to increase the error rate from the plus or minus 2%, which is required now, to plus or minus 5%. What that really means is you're going from about 2,400 moments that you have to engage the different providers in at the school-based services level down to about 400 moments in a particular quarter. That will help ease administrative burden on the providers, not having to answer as many, moments when they get those emails and the stress that goes along with that, which we've heard a lot about from stakeholders. Also, the time study notification period and response period. Again, we feel that the zero notification window is, the gold standard, but we will entertain up to a 2-day response and a 2-day notification window ahead of time for folks to answer those particular moments for the RMTS, and that's all for time studies. Next slide, please. This is all about the new flexibilities with documentation. So we're allowing some de-identified data that would allow, the LEAs to furnish some, and that would have to be negotiated and talked about, but some de-identified or mass data to support things like the Medicaid enrollment ratios. Some states have balked and said that FERPA does not allow us to disclose even a denominator or a ratio of the number of students enrolled in IDEA or IEP programs. Again, we can't supersede requirements for that are in regulation or statute, but we are allowing some of that. Again, we also are allowing a general allocation ratio. So when you think about cost-based methodology, you start with this big pool of money, and then you have to allocate it down to medical services, and then usually there's a second allocation which allocates it down to the Medicaid program. And so with opening up free care, we have different sets of Medicaid enrollment ratios. For instance, we could have one for IEP students, right? We could have the number of IEP students enrolled in Medicaid divided by the total, IEP students in that LEA, and that amount of money would be, cost allocated down into Medicaid using that ratio. There's a more general ratio which you could use, and that would be just the total number of kids in the LEA that are enrolled in Medicaid divided by the total number of kids, in the LEA, which is generally a publicly available, data, right, the number of kids in an LEA. And that could be used overall for ease of administrative burden for all services if need be, or they could, states have the flexibility to use a breakdown of those. Again, depending on, how sophisticated they are or how they want to claim those services, they certainly can do that. And that flexibility is open now. Next slide continues with some of those flexibilities in documentation. And one of the things is the utilization of a time study like the RMTS could be used, and you could do a one-step process where you send out the moments to individual providers and you ask them not only to say, what you were doing at that particular moment, like a medical service, for instance, but you could also ask them, or someone could check it on the back end, of course, to see if that was a Medicaid student or not. So it could be done potentially in a one-step process. We've opened this flexibility up as well. Next slide, please. For provider qualifications, this always becomes a discussion because, again, every state is a little bit different in how they have particular providers licensed and how they're under what agency they might be licensed. For instance, school counselors are often licensed through the Department of Education, whereas outside of schools, counselors are generally under some other board of psychiatry or whatever else, right? So in this case, we're allowing it some ease in our provider qualification rules, and allowing states to kind of come to us and talk about what provider qualifications are for school-based providers, and if they're any different from the qualifications outside of schools, and to try to align those as well as possible within the state plan methodology that I mentioned before. They might have to submit, might need some changes, might need some reworking, but again, we're trying our best to align those and to allow schools and providers to easily bill for Medicaid services. Next slide, please. And finally, we've eased up our third-party liability or reimbursement issues, and those really are allowing states to suspend or terminate efforts to seek the reimbursement, because usually you have to go to every other potential source of payments and insurance, et cetera, before you go and you hit up Medicaid, because Medicaid is always the payer of last resort. But in the case of IDEA and 504 services, at least for IDEA, it's Medicaid can be the payer of first resort. Okay, so any of these services, IDEA, 504, or just general Medicaid kids, we've allowed this third-party reimbursement kind of flexibility. Next slide, please. So again, we just generally discussed, those are a flavor for most of the flexibilities that we're offering in the new guide. If you're not adhering to any of those policies, or you want to take advantage of some of the flexibilities, we would like departments of education to talk to state Medicaid agencies, talk about the flexibilities together, because that's what it's going to need to start. And you're going to need to submit a state plan amendment, or a time study implementation plan, or an administrative claiming guide. There's a variety of different tools that we use for approvals to Medicaid. But regardless, everybody has to be in line, and we're giving 3 years by June 1st, 2026. So we published in May of 2023 this year. We're giving everybody 3 years to come into compliance with the current guidelines. Next slide, please. So again, I'm going to talk a little bit more about the Technical Assistance Center. It opened in a couple months ago. We secured a contractor. It's Econometrica, and they have several subcontractors working with them as well, like Mathematica, University of Maryland. We have a variety of TA materials that we now have on Medicaid.gov. And I'll give you the link here in a few moments. And under that, we've also provided some approved state plan amendments that people can look at and use as a guideline for either a cost-based methodology if they want to go that route, or they can also look at the fee-for-service route as well. We have some examples of both, and we have examples of free care policy, the language that would be involved in a state plan amendment for opening up free care. We have an approved time study implementation plan and some sample cost reports that various states use to capture those costs and to reconcile those to the actual services being delivered in schools. We also have up there the guide, of course, itself, and a listing of HHS school-based health service resources, and a couple other things like our state Medicaid director's letter that opened up free care back in 2014. And we're continuing to expand that. And we're working on FAQs right now, because we've gotten a lot, and we'll go to the next slide, please. We've gotten a lot of questions in our email box, which I will share with you in just a few moments as well. And from those, we are producing some FAQs. So the Technical Assistance Center, this is the vision. Again, primary audience is going to be the LEAs and schools and other school-based providers, but also, of course, they're going to have to work with the states, and those specifically, the Medicaid and education, personnel and those agencies, because it's a big collaborative effort to provide these services in schools. And again, we're going to try to answer as many of those requests for assistance, whether that be how to formulate a plan, where to start. We're going to do a webinar next month. We're going to talk about the basics, 101s about, how do I go about starting and getting new services in schools? How do I open up that conversation? That's going to be coming up in September. And then also resolving new and emergent Medicaid and ed-related school-based issues. We've had a lot of questions about like the provider qualifications. So we're going to be bringing out more policies and more technical assistance on those type of things. Coordinating with a lot of different states, I'm sure, again, as they'd like to, open up that conversation with the Medicaid and education departments and how to, again, provide more services in schools, and if there's any like provider qualifications or other issues that we can help resolve. And just in general, trying to reduce the overall burden for schools by publishing best practices, showing how other states do it, and getting that information out to everybody so that they can, look at it, pick up what they'd like to, and try to expand the services for the children in the schools. And I will say, Wyoming this year finally approved, it was the 50th state to open up reimbursement for Medicaid for just IDEA services. So you don't have to provide, hit up Medicaid for IDEA services, but it's a great idea. So everybody's out there, everybody's eligible for Medicaid at this point. Not everyone, only 13 or 14 states are open now to the free care. We'd like to see that expanded and provide more and more. And again, we'll be providing trainings, webinars, peer learning. And if you want to be involved in that, let's go to the next slide. At the bottom of this page is our school-based services. Go to the next slide, please. There we go. At the bottom of there is our email address. You can email us technical questions, but you can also email us in case you want to be on like a listserv of, when the next webinar is, or if you want to ask a question, or if you just want, to say thanks or whatever else, you can email us right there. I have a Technical Assistance Center, the landing page. It's an embedded URL, so when you get the slides after this, you can click on that. It'll take you right to our Technical Assistance web landing page, and there'll be more and more things appearing on that website. Again, next week we're going to have a kickoff webinar, and we're going to have at least one in September, possibly two, based on feedback. We're already going to do the 101 about how to get started, how to change, how to take advantage of flexibilities. And we're going to continue compiling FAQs and looking at those best practices and getting those up and disseminated, and having things like state plan amendments, new ones that come in, time-set implementation plans that take advantage of some of the flexibilities we will start publishing as those come in, and cost reports. And also just links to any kind of ed or CMS guidance that we feel is helpful for you guys. That's where we are. And let's go to the next slide, which is really the last slide. And this is just telling you when you get to the slide deck, some, again, embedded URLs here where you can click on these and get some basics. And again, our email address for technical assistance there. Okay, so that's all for me today. And I think we're going to have a few questions, and I'll do the best I can to answer a couple if we have any in the Q&A box. Otherwise, thank you all for your attention, but I'll stick around here for a bit and wait for any follow-ups or questions.
Thanks, Richard. So we do have one question in the Q&A. Do flexibilities noted apply to early intervention services, IDEA Part C, not delivered in schools?
IFSP, yeah, potentially, yeah. It depends on like Head Start programs and things like that. We touch on it a little bit in the guidance. If there's specific questions, again, email us and we'll try to answer that. We are trying to expand and create some subject matter experts in Part C, the IFSP, world. We generally talk about IFSP, but having talked to the Department of Education, they've taught us a lot about. I didn't even know what Part C was 6 months ago, so I've learned a lot. It technically applies, yes, but it will not necessarily be applied in schools because these kids are usually younger than school age. But I know, some schools do have Head Start programs and things like that that might apply to the IFSP folks.
And we have one other question that came in. Oh, yes. Participants will be receiving a copy of these slides. So these slides will be posted onto the TA event page. And I'm going to post that link into the chat here again. And those will be available sometime tomorrow. And Richard, we have one other question for you. So to clarify, TPL applies for services provided for section 504 unless a state gets a waiver. If so, are there instructions on what needs to be in the waiver?
I don't know what you mean necessarily about a waiver. The third-party liability rules I could get more into, but in general, Medicaid is the payer of first resort for IDEA services, not necessarily 504. But the TPL, the new flexibility, does apply to any enrolled Medicaid child in a school. Doesn't matter if it's 504 IDEA or other plan of care or not in any plan of care. If the LEA can demonstrate that going after those third-party, claims would be, cost prohibitive, then they don't have to do that. Hope that helps.
And I think there's a follow-up question. Can the state do that overall, or does each LEA need to do it?
Yeah, I mean, logistics, you probably need to contact the box and we could talk to the subject matter experts in that area. That's not me specifically. So that's what I would say for that. It depends on the state. Again, you see one Medicaid agency, you've seen one Medicaid agency. It really does depend on the circumstances of what's going on. I would assume that each LEA, just like with claims, each LEA is going to have to keep, the auditable material available, except for like an RMTS, a time study that's done on a state level. That would probably be the state Medicaid agency's responsibility. But for the individual claims, the minimum documentation requirements, any documentation that you had that, you tried to go after TPL, but it was going to be too cost prohibitive, would probably be at LEA level. But it depends on the state. Some states might have some kind of office that deals just with TPL in Medicaid or in general, So it will depend greatly on the state.
All right, if there's no other questions, I think we can wrap this up a little early.
All right. Well, thank you for your attention, everyone, and really appreciate the time and write us in the box. And thanks again for the invitation. Katie Neese from OSERS and Dan Schreier from OSEP and all the organizing people here. And thank you, Al Jones, as well. Appreciate it. Hopefully see you soon.
Thank you, everyone. This concludes our technical assistance call for today.